Hello and welcome to my WifOR Journey, a series exploring WifOR through the experiences of colleagues and the work they do. My name is Danny, and this conversation is going to explore what a researcher in health economics at WifOR does. I'm joined in this conversation by Dr. Eva Levi from WifOR's Athens office. Hello, Eva.
Hi, Danny, and thank you for inviting me to have this conversation with you today.
Thank you for joining me. Maybe we could start by hearing a little bit about you. What is your background? When did you start working at WifOR? And what is your role here?
Sure. So I'm a molecular biologist with a master's in molecular medicine and a PhD in immunology. I did my studies in the UK, and then I moved back to Athens, Greece, where I first worked as a researcher in basic research for a few years. Then I moved to the pharma industry, where I worked in clinical development and medical affairs in 3 big pharma companies and a couple of small enterprises for approximately 13 years. And I have been working in the field of health economics since September 2021, when I joined the WifOR Institute as a senior researcher in the health economics department.
Okay, before we get into what it is a health economics researcher does, let's take a look at the field of research. What is health economics, Eva?
Health economics is an applied, rather broad field of study. In very simple words, the application of health economics reflects the universal desire to obtain maximum value for money by ensuring not only the clinical effectiveness, i.e. the effect that the medicines have on the health of patients, but also the cost effectiveness of the interventions of the healthcare provision. And this is important because by measuring both quality and cost of medical care, health economists can determine how people pay for care, how these payments are processed, and how health systems around the world can be restructured and improved.
Bearing this in mind, what is your role as a health economics researcher at WifOR?
I have a dual role. I am a researcher and I am also a project manager in the health economics team. As a researcher, I'm involved in measuring the social impact of medicines. And by social impact, we mean the value that specific medicines bring to the society in addition to the health benefits. We have actually developed ways where we can monetize the quality of life brought by these medicines. We aim to prove that greater health brings greater wealth to the society. I am also a project manager, which means I am overseeing these projects.
Okay, so a dual role at WifOR, a researcher and a project manager. Could you tell us what are the most valuable skills for being a researcher at WifOR and the most valuable skills for being a project manager?
So as a researcher, one should, first of all, be open-minded. They should be able to question everything, but at the same time, one should know what to trust. And as a project manager, the responsibility is to ensure the team delivers a project in good quality, on a timely manner, and within budget. So planning, communication, and risk management are very important skills, but also patience and being a good listener are very important. And being a good listener also for understanding customer needs and also understanding the team's needs.
And what does being a researcher at WifOR offer you?
So I very much like working as a researcher and as a project manager at WifOR. First of all, I get to further develop my project management skills and also people management skills. But most importantly for me, I get to interact and learn from skilled and amazing colleagues all the way from Berlin, such as yourself. WifOR also offers a hybrid and very flexible work model. I can work from home, I can work in the Athens office, I get to visit the Darmstadt offices and interact face-to-face with colleagues there. And in addition, the actual work we do, so the field that we work on, these analyses become more and more important in decision-making throughout the world. And I'm very happy that I can participate in this kind of work and research.
Do you have any pearls of wisdom for someone potentially interested in becoming a researcher at WifOR?
Sure. So WifOR's culture is all about transparency, giving feedback, and it allows you to further develop both your technical and soft skills.
Okay, I'm going to try to succinctly summarize what you've just told me into a 30-second nutshell, and then you can tell me whether I've been listening or not. So, health economics seeks to measure how investments in healthcare provision and medical interventions can be most effective. As a senior researcher in health economics, you work on a variety of projects seeking to uncover the value medicines have for society. You also divide your time between research and project management, ensuring the quality and efficiency of projects. And valuable skills for being a researcher would include being open-minded, curious, critical in analysis. WifOR offers you the work environment which encourages learning, personal development, and research which has a real-life impact. Plus, incredibly interesting yet thoughtful colleagues, obviously. How did I do?
Perfect.
Thank you very much for joining me, Eva. It's been a pleasure.
Thank you very much, Danny. It's been a pleasure too.
If you're interested in finding out more about WifOR or our research, please take a look at our website or get in touch with us. Thank you for listening.